Hi, this is my OCD diary. My name is Julia, and today I want to talk about naturopathic medicine. So basically for me, this is the big thing that made my OCD get better. So I still talk about OCD from the perspective that I have it, but nothing like what it was. I'd say 90% of my symptoms have been alleviated, and therapy is definitely a part of that. In the days where I still feel like things are kind of popping up or I'm getting a little symptomatic, that's when therapy comes in. But most of it is pretty much gone. So, and I get a lot of questions about that, so I thought I would do a video and kind of address sort of what happened and how it works, and if you're interested in doing kind of what I did. So, basically, naturopathic medicine it encompasses a lot of different types of alternative therapy. So it works differently from Western medicine in that it's more holistic, meaning that it's going to focus more on healing the whole body and a little less on symptom management. So symptom management is still very important, but it's really about finding the underlying cause of the problem. And to me, that was very appealing because I really wasn't interested in SSRIs or antidepressants because they really scared me, and I really didn't want to it wasn't enough for me to just feel better, although that's what I wanted. I wanted to just fix what was feeling so broken in me and in my brain, and so that's how I felt. But anyways, so I went to go see a doctor of naturopathic medicine, and I spent about an hour or two with her the very first time I saw her, and that's a big difference too. They really want to do a very big analysis in terms of like getting your entire history and finding out what else may be going on and contributing to your symptoms or whatever disorder or conditions happening. So I spent a long time with her and we went over everything, and then she did her diagnostic tests and talked about the treatment plan. And the therapies are very different too. So like for her, she did a lot of micronutrient therapy, which means vitamins and mineral and adjusting those things in the body and working with deficiencies, making everything balanced. And she also does some homeopathy, a little bit of herbology, and those are also common and with any naturopath, although every naturopath has their own kind of style and what they want to do. Other things might include acupuncture and hydrotherapy and, there's a whole list. So that's what we did. And so I left that day with a giant bag full of supplements, and I went home and I just had the best sleep ever that night. So I was pretty stoked, and within a month I felt like I was doing really great and I could see some really noticeable improvements. So it's been at least 3 years now and I'm doing really great. I go see her every 3 months just to tweak my diet, make sure that things are good, and if I'm having a flare-up in terms of me being sick and I'm starting to get anxious, like we'll kind of deal with that and change things to kind of help at that time. So it's been great and I love it. That's what I want to go to school for now, so that's what I'm working on because I feel like it just changed my life. So people ask me like what I eat, but unfortunately I can't really help with that part because see, naturopathic medicine is very customized, meaning that if you go to a Western doctor, based on what you tell them, your symptoms and what they determine is wrong with you, they're going to go off of guidelines and say, okay, this is what you get. But naturopathic medicine is a little different, meaning that every individual is different. So there are guidelines, but it's really just tailored. So like for me, for example, a lot of my OCD had to do with my thyroid and different other deficiencies that were off or things in my body that were off. But that may not be the case for you, because if your thyroid's perfectly fine and it's got more to do with maybe different hormones, then my diet or my supplements may be completely irrelevant to you. So it's not, any more magic than Western medicine is. It's all based on like, okay, let's find out what's going on in the body and correct the imbalance. So the other thing is people ask me a lot for her information. I don't really give that out only because she's been so busy lately. She's asked me to stop doing it because she just can't take on any more patients anytime in the near future. But in the link section, I'm going to put a website you can go to, like in the notes down below, where you can type in your zip code and find naturopaths in your area and see if maybe that appeals for you. So that's just what I did, and I'm convinced there are a lot of things out there besides SSRIs or therapy, although I do think those are really important. But to me, it was about having options to find the right treatment that worked for me. And everybody's different because somebody else could use SSRIs and that might be the total key. So, yeah, you have to find what's best for you. But anyways, I hope that answered some of your questions about what I did and a little bit more about naturopathic medicine. But either way, it's a journey and it's a process, and it really is just going to take time and work. And the biggest thing I've learned is that there's no magic fix, but there are results worth having. So it's about, I know all of you have put in the work so far about keeping things manageable, and we all just have to keep going. So stay strong.